Coronary artery disease, or CAD, is like when your heart's roads get clogged. Imagine the roads leading to your heart being highways, but over time, junk starts piling up, making it hard for cars to drive smoothly. The junk we're talking about here is cholesterol, fat, and other stuff that your body stores over the years. These highways, better known as coronary arteries, are supposed to keep your heart running smoothly by delivering oxygen and nutrients. But when they get blocked, trouble starts brewing. So how does this junk build up? Well, over time, as we indulge in greasy fries, juicy burgers, and sugary treats, our bodies start storing more and more fat. And guess what? It doesn't just sit on our waistlines. It sneaks into our blood vessels too. Slowly but surely, fat sticks to the walls of your arteries like chewing gum on the bottom of a shoe. This leads to plaque, which is just a fancy word for a sticky mixture of fat, cholesterol, and calcium that narrows your arteries. Now imagine trying to breathe through a straw that's almost blocked. Not fun, right? That's what happens to your heart. It struggles to pump blood through those narrowed roads. When this happens, your heart starts complaining, and that's when you feel things like chest pain, shortness of breath, or even get hit with a heart attack. Yep, the heart doesn't like clogged roads either. Chest pain is one of the most common symptoms. It's like your heart sending an SOS when it can't get enough oxygen. The pain can feel like someone sitting on your chest or even like heartburn. But here's the catch. Not everyone gets chest pain. Some people might just feel tired, like they've run a marathon, even when they haven't moved much at all. Others might feel pain in their arms, shoulders, or jaw. Weird, right? But that's how the heart works. It's full of surprises. And then there's shortness of breath. Imagine trying to catch your breath while sitting still. You haven't climbed a flight of stairs, but it feels like you have. That's your body's way of saying, hey, something's not right down here in the heart department. But here's where things get serious. If one of these plaques in your arteries breaks open, it's like popping a balloon. The body freaks out and tries to fix the break by forming a blood clot. But this clot can completely block the artery, cutting off blood flow to a part of the heart. That's a heart attack. And let me tell you, your heart is not a fan of heart attacks. It's like cutting off the electricity to your favorite TV show mid-episode. Everything shuts down, and the damage can be pretty bad. All right, now that we've scared ourselves a little, let's talk about how to prevent this. The good news is that you can do something about it. You're not just sitting in a car on a road to nowhere. First up, eat better. Remember all that junk we talked about earlier? Cut it out, or at least cut it down. Switch out those greasy fries for some veggies. Maybe swap that burger for some grilled fish. It doesn't mean you have to say goodbye to everything fun. Just make better choices most of the time. Exercise is your heart's best friend. Picture your heart as a muscle because, well, it is. And like any muscle, it needs a workout to stay strong. You don't have to become a marathon runner, but regular walks, bike rides, or even dancing around the living room can help. The more active you are, the better your heart pumps, and the less likely those arteries are to clog up. And speaking of clogging, let's talk smoking. If you smoke, your arteries are basically begging for mercy. Smoking damages the walls of your blood vessels, making it easier for the plaque to stick around. So, if you're a smoker, quitting is one of the best gifts you can give your heart. It's tough, no doubt, but there's a ton of help out there, and trust me, your heart will thank you. Now here's another biggie. Manage stress. Life gets stressful. We all know that. But constantly being in stress mode is like revving your car's engine non-stop. Sooner or later, something's gonna give. Find ways to chill. Maybe it's yoga, meditation, or just zoning out with your favorite book. Whatever works, make time for it. Your heart will appreciate the break. And lastly, regular checkups are key. You might feel fine, but that doesn't mean everything under the hood is running smoothly. Doctors can run simple tests to check how your heart's doing. They'll look at things like your blood pressure, cholesterol levels, and other signs that might hint at trouble down the road. Think of it as a tune-up for your body. In the end, preventing coronary artery disease isn't about living in fear. It's about making smart, small changes that add up over time. You don't need to overhaul your whole life in one day. Just take it step by step. Eat a little better, move a little more, breathe a little deeper, and check in with your doctor regularly. Your heart will do the rest, pumping strong and steady, ready to keep you going for the long haul. And remember, while you can't control everything, like aging or family history, you've got the power to make choices that keep your heart highways clear and running smoothly. So, take care of your ticker. It's got a lot of love to give.